I'm going to talk about cycling injuries and hopefully how to prevent them. So overview of the talk, basically, I'm not really going to talk about traumatic. We're going to focus on overuse, but review the position on the bike. We went over that a lot yesterday. Rule out that as a contributor. Two main concepts with overuse injuries are load tolerance and inhibition of your tonic or stabilizing muscles. And the main injuries I'm going to focus on are going to be the knee, the neck, and the lower back. Then we're going to talk about within each one, key areas to strengthen, key areas to stretch and retrain. So traumatic versus overuse. One slide on traumatic. Obviously, there are unavoidable incidents that happen, like a sign suddenly appearing. It can be the road or the trail conditions, technical terrain, traffic. There's all kinds of things that are out of our control. Mechanical failures. Check with your mechanics, make sure things are operating correctly. Fans, photographers, things of that nature if you're a racer. And just sidebar, just learning to ride safely in the Peloton can avoid a lot of accidents. Being aware of road rules and safety, bike handling skills, the cornering, descending, and holding your line. Not being a crazy rider. Okay, overuse injuries. I'm gonna spend most of our time on that. So most common is the lower back, then the knee. And the knee, it's usually a lot of patellofemoral, so the front of the knee, patellar area. You can get some hand neuropathies. Hip, we get trochanteric bursitis sometimes, and iliopsoas tendonitis because of the pulling up on the pedal stroke. And in the foot, you can get just pain in the foot, plantar fascia. Most common is probably Achilles tendonitis type of problems. Those statistics come from American Family Physician. So in an epidemiological analysis of overuse injuries, this is recreational cyclists. Most common is the neck, followed by the knee. 11% stop cycling because of overuse injuries for a period of time. Almost 3% totally quit cycling because of some kind of overuse injury. So we can prevent that, keep people on their bikes. That's awesome. So ergonomics, when I took a course on ergonomics, this is in the office, we focus on three things, which is very similar to it. Yeah, on the bike. Ergonomics on the bike, similar to an office. You want to think about lengthening your spine, sitting with good posture, having good posture on your bike. It's cyclist anatomy. Then you want to be, it's how you set up the bike. That's number one, actually. So if you're going into an office and you're going to help somebody in their work setup, you check the height of the computer and the desk and the chair. So similarly, that would be the bike fit setup. Then awareness of your posture, how you're riding your bike. Similarly, how you're sitting at your desk. So you can change those things if you're aware of it. So you may be just over rounding your back. And if you just have some cueing and you learn how to lengthen your spine a little bit, that can alleviate a lot of stress. And then moving away from static positions is the third thing. So if you're riding your bike for 4 or 5 hours, changing your position, getting out of your saddle, shifting your weight around, all those things can help alleviate some stress. So 3 main things with overuse injuries. Number one, again, is the bike fit. So all the stuff we talked about yesterday with the saddle, the cleats, the bars. Training factors could be strength flexibility, your cadence. So how you spin on the bike. If you're pushing big gears all the time, that can make a difference in an overuse injury. The resistance, how much you're climbing, if you're used to it or not. And your recovery time, also super important. As far as the cyclist anatomy, things like how the kneecap is tracking, their tightness, femoral length, spinal alignment, leg length discrepancies, things of that nature. All of that can contribute to anything that would be called an overuse injury. So just back to the bike for a second, remembering that all of the things we talked about yesterday, the fore aft of the saddle height, the crank length, handlebars, all of that can contribute to, if it's not set up correctly, an overuse injury or undue stress on tissue. And also remembering that if you adjust one thing, it affects another. So if you change the fore-aft, the forward or back position of the saddle, that's going to affect your reach. And so we talked a little bit about that yesterday too, with somebody like a teenager or a juniors rider who is growing and therefore raising their saddle higher and higher, and how again raising the saddle can effectively increase the drop. So just keeping that in mind. Okay, now so the big take-home message is load tolerance. So we all know that cycling is very repetitive in nature. So if you go for a 2-hour ride, it's roughly averaging 90 RPMs. That's about 10,800 pedal strokes. So obviously lots and lots of pedal strokes. Professional cyclists can ride about 450 miles a week. Recreational cyclists around 90 miles a week. If you have a biomechanical issue, it's like riding a car that's slightly out of alignment. It can add stress to tissue and therefore cause some discomfort. So overuse injuries are primarily related to tissue overload, tissue damage from submaximal loading. So microtrauma caused by inadequate recovery time. So everything we talked about also plays into a factor. What Clyde talked about with nutrition, James talked about as far as making sure you're recovering, spending some time resting, reducing your load. Big difference. So think about it as load versus capacity. So our tissue can be muscle, tendon, ligaments, just in your back. Everything is made up of collagen, and all that collagen has a certain ability to adapt and a certain capacity at any point in time. So if you were to apply a load gradually over time, gradually increasing your training, your tissue has a chance to adapt and no injuries would likely occur. If you were to increase it really suddenly, let's say we briefly talked about Everesting. If you're familiar with that, you go out and you do, how many thousand feet of climbing is that? 29,000 feet of climbing. You need to train for that, obviously. If you were to go out and do that without the proper training, your tissue, the load goes way up. The capacity for patellar tendons, joints, your neck, any tissue in your body really could be overstressed because you increase the load, but you don't have the capacity, the tissues don't have the capacity to match that. So overuse example, again, if you apply the load faster than the body can adapt, that's the capacity, the tissue can get damaged. You might have some pain or discomfort. If your load and capacity are pretty consistent, you do the similar rides every week, total time ridden, intensity is pretty constant, all can remain pretty well unless nutrition gets affected, stress, you're not sleeping well, you're not eating well, everything that Clyde talked about. And again, James, as far as just giving yourself time to rest. Maybe you have a cold and you're sick, but you gotta go out and ride anyway. Those things can lead to just you're overly fatigued and you get your tissue doesn't adapt as well. The other thing to remember is once you're injured, so now you've got a little bit of ache in the front of your knee, or it's hurting when you walk, you go downstairs, things of that nature. You might have to temporarily reduce the load. So a lot of what we do in physical therapy is teaching people that's not a good idea. I think you need to back off a little bit versus, but not completely stop. So a lot of times we'll get patients that'll come in and say, God, my knee was really hurting. So I took 6 weeks off and then I jumped back on my bike and I rode 2 hours and it still hurts. I don't know what's going on. So what we have to do is teach them, well, maybe not starting off with that amount because that was too much load for the capacity still. Let's back it off a little bit. Maybe start doing some exercises that simulate it, see how the tissue responds, and then maybe go out for 30 minutes and we guide them through what they can do to get them back to their prior capacity. So that's the kind of gist of load tolerance and capacity. Does that make sense so far? Okay, cool. 4 main categories of exercise. Strengthening. I love that Bill talked about that yesterday with his track riders. I actually had the same coach they were talking about. Jim Miller was my coach years and years ago when I raced. And we did a lot of strength training in the off season. I'm sure most cyclists do, but trying to emphasize that for some that don't know the benefit of strengthening, how it increases not just your strength on the bike, but prevention of injuries. Because now you've got, when you're strengthening in the gym, you're strengthening the tolerance of the tendons, the muscles, the joints. So you may not have pain while you're biking, but you get off the bike and you lift something and now you have a disc problem or a knee problem, anything of that nature. And then Clyde touched on the importance of flexibility. Stretching is super, super important. We touched on that yesterday with the bike fit as well. So if you want to get in a really aerodynamic position, you have to have flexibility in your hamstrings. You have to have flexibility in your spine, in your hips, etc. So a little stretching, super, super beneficial. And then cardiovascular is, oops, forgot number 3. Motor control is a lot of what we do in therapy. So retraining people, Clyde touched on that a little bit too, just the importance of how you're moving. We'll get to that in a second. The 4th category you've all got because you ride a bike, it's cardiovascular. So strengthening and load tolerance. The image on the right is from American College of Sports Medicine, just all the benefits of strengthening. And again, going back to the load tolerance, it includes all collagen. So working on strengthening will improve core stability, perhaps, pedal efficiency, prevention of overuse injuries, and can improve strength more so than just cycling alone. And then we touched on this briefly already, just the importance of flexibility in certain areas. One area, when you think back to that the office image, person bent over the bike, the person kind of hunched over their chair in the office. Thoracic spine mobility is super important. That's their upper back. And then motor control. So what is motor control? It's the way in which the nervous system, that's your motor, sensory, and central processes, control posture and movement. So when I explain motor control to patients, just like James said, baseball is an easy one to explain. So if we want to improve your motor control, think of a baseball player, somebody that's never picked up a baseball before, and you ask them to throw the ball. It's probably they're not gonna have great mechanics. How they throw the ball is gonna be maybe not the greatest. They can't maybe hit the strike zone, it's going over there, so they need a lot of coaching. So as therapists, we're doing the coaching. We're helping them learn motor control of whatever body part we're working on. And the thing about motor control is studies show it takes around 5,000 repetitions to improve it. So never picked up a baseball before, throwing it, it's terrible. It's all over the place. Your form's awful. And a lot of times patients get really frustrated because you're telling them, you're coaching them along with, this is how you can make this movement pattern better. And they can't quite get it. But when you explain, well, it doesn't matter if it's perfect initially, we're working on it. It takes lots and lots of repetitions. One example is in the lumbar spine, you get inhibition of your transverse abdominis, multifidus, super common, your core gets weakened. So we go through core exercises and it's really difficult. But if you understand that it's just going to take thousands of repetitions of going through something, and if you do an exercise daily with motor control, it's really 6 weeks of your life to kind of get things recircuited and back to normal. So similarly, on the bike, we've got one of the black mountain bikers there, descending, obviously it takes some motor control to control your bike. It takes balance and coordination. That's Kate Courtney there. I stole that off one of her things. So more specifically, let's talk about the knee. So if you have pain in the front of your knee, that's anterior knee pain. It's one of the most common overuse injuries reported among cyclists. You can have patellofemoral. So the patella is your kneecap and how it moves in the trochlear groove. So your femur has a little groove and the patella has to glide in that groove. It can get pulled to the side, it can get compressed too much. Things like tightness in your quadriceps. So your quadriceps tendon attaches directly to your patella, and then you have a patellar ligament that goes from the patella to the tibia. So think of it like a pulley system. If you're tight above or below, it can compress the patella more, it can affect how it moves and cause some pain. On the bike, it could be improper cleat position like we talked about yesterday. The most common muscle imbalance probably that affects the knee and problems of knee tracking, if you will be weakness in the outer hip, the hip abductors. So Patellofemoral Syndrome, you can see the patella and how it sits on the femur. There's a contact point there. It presents as pain behind the kneecap. It increases pressure across that patellofemoral joint. So patellar maltracking or limited mobility of the patella can also cause some trouble there. So saddle height, we talked about that yesterday. Patellofemoral joints are increased with a lower saddle and with increased workload. So one of the things you look at first was a cyclist that comes in and says, the front of my knee is hurting when I ride. Is the saddle too low or too far forward? Training errors, this goes back to the load tolerance. If you suddenly increase your mileage, you increase load and volume before the tissue is ready. Lack of sufficient recovery time, pushing a high gear. So I've only recently started working, I don't know if you can say working with, but riding with some juniors, just teaching them how to spin a little bit more. That helps with recovery, helps reduce the stress on the knee. And gear ratio as it relates to strength. So if you haven't done the work in the gym, if you don't have the strength and you're pushing a big gear, you're doing a lot of climbing, you can overload the tissues and then have problems in patellar tendon, patellofemoral joint. And then there's pedal cycling mechanics. So how you're pedaling your bike. If you toe down quite a bit, it's kind of like walking around on your toes. You're putting more load in your Achilles tendon. So learning how to drop your heel during the pedal stroke just a little bit can offload, or at least give the Achilles tendon a little bit of a break. It's also more efficient if you learn to drop the heel just a little bit as you're pedaling. When you're recovering from a patellofemoral issue, avoid things like going out and climbing for a long period of time. Go back to it nice and slow. So when we treat it, it's progressively increasing the load tolerance through strengthening and or biking, or combination of the two usually. Stretching, if you remember the image of the patella and the quad tendon, if you're really, really tight in your hip flexors and your quadriceps muscles as they attach to the patellar tendon, that can cause some trouble. So stretching is going to be very, very helpful. We can also use taping to help unload the patella. So if you're really in a lot of pain, sometimes we resort to things like taping to help support the patellar tendons. Board orthotics or wedges, we talked about that a little bit yesterday to help control the pronation. So pronation is when your big toe side of your foot's kind of collapsing in. So what that looks like on the bike is your knees are dropping in towards the bars quite a bit. So again, you can use wedges, orthotics, or retraining. And sidebar for the mountain bikers, I know when you're mountain biking, if you have a lot of descending, usually you have your dominant foot forward. So that foot, that knee is getting a lot more load than the knee that's back. So it tends to be one leg dominant, increasing load on that side. So how can you reduce that load? If you can switch it. I can't do it. Switch feet when you're descending, or just take a few pedal strokes at least to offload the stress on the patellar tendon. And training the tissue to tolerate a sustained load. So that picture earlier of, I don't know if that was on there, but standing on one leg in a bent position, holding a squat, catching a ball, doing things proprioceptively can help train you for something like downhill mountain biking. So briefly, lateral knee pain, pain on the outside of the knee, could be the iliotibial band friction. It's most commonly tight at 30 degrees of knee flexion, so the bottom of the pedal stroke. So you want to check the saddle height, make sure it's not too high in this case. Always checking the cleat position too. And if you remember yesterday, we talked a little bit about moving the feet in or out. Remember the guy that's riding with his knees really wide? That might potentially put some stress on the iliotibial band. No, I said guy, it could be a girl. The other thing is you want to make sure with lateral knee pain and patellofemoral knee pain, back to the hip stabilizers. Gluteus medius, the outer hip, is super important in stabilizing your knee to avoid overpronation. So looking at their pedal stroke can definitely be helpful. So fit guidelines for the knee. Remember the front of the knee, if it's painful, usually it's moving the saddle up and back. You might rotate the cleat externally. So if the foot's turned in too much, you might have to readjust. If you have pain in your hamstrings, your saddle might be too high, possibly too far forward. For medial and lateral knee pain, it's usually a cleat position. Stretches. Sidebar, I also teach yoga, so there's a few yoga poses on here. I think stretching is super, super important for the downtime, for the tissues, and it just really feels good to stretch. So main areas to target, this is for the knee, obviously the quadriceps, hip flexors. So one of your hip flexors, your rectus femoris, is also a hip flexor. So if you combine hip extension, that's going to often help with the patellofemoral issues. Additionally, as cyclists, we're often in that bent over position and you never get full hip extension on a bike. If you double that up with a job or you're a student and you're sitting in a chair all day, your hip flexors can get super tight. Then you become that cyclist that gets off the bike that can't straighten up all the way, and that can contribute to other problems like low back pain. Stretching your gluteals and definitely your calf. So strengthening, Bill talked about this in the gym when he was talking a little bit about his strength training for the track. I love that he brought up that they do a lot of single leg stuff because we do that a lot in therapy just to bring out any imbalances. So any form of a single leg squat also requires less weight. So it's easy to do at home. You don't have to have a gym. So during COVID times, a lot of people stopped lifting. A lot of people stopped going to the gym for obvious reasons, but there's a lot of things you can do with just your body weight that will help adapt, get you ready for getting back on the bike. Motor control. So talking about the knee, a single leg squat test. That's just standing on one leg and looking at what happens when the patient squats. You can see the red line. If we see that with somebody that's squatting and they're here for their knee, maybe even their hip or back, we're going to cue them first to see if they can stabilize the knee and definitely retrain them as far as the motor control. So again, you go back to the hip. Do they have weakness in their hip that's causing the knee to drop towards the big toe side of the foot and collapse? And also looking at their foot. So in general, any kind of problem in the knee, you look above and below. So you look at the hip, look for weakness and restrictions, and you look at the foot and see what's happening down there. So if you overpronate, the foot collapses, you have a flatter arch that can contribute to the red line example of single leg squat test. So how does that apply to when you're on a bike? Single pedaling drills, I think, are really awesome, and anybody can get a laser at the hardware store. So I'll use this in the clinic sometimes to say, okay, you can see in the mirror what's happening with your knee when you're on the bike and how it's wiggling in and out. Are you able to actually stabilize it if you look at yourself in the mirror? And a lot of times they can retrain that movement, just like you can retrain somebody to do a squat without their knee dropping to the inside. So working on the laser and the pedaling stroke can definitely help unload certain tissues. And then giving them pedaling drills. So Some people will, especially when maybe when they're come from a running background or they haven't been on a bike before, a lot of the pedaling tends to be from the pushing down aspect of the pedal stroke. So if you do a single leg drill and you listen to your pedal stroke, you can hear a nice smooth sound. It just kind of hums along if you're pedaling through the whole pedal stroke. If you tend to be somebody that just pushes down on the pedal stroke, you hear this really hard sound and then a rest. And you can listen to it, you can feel it. If you're doing it with one leg, it also, it really teaches you how to pedal throughout the pedal stroke. So that's one way. Also doing really high cadence spinning drills will help smooth out a pedal stroke. So all of those things kind of under that motor control, but specific to cycling. So summary exercises for knee pain, stretching quads and hip flexors. Secondary, you want to make sure you're stretching your glutes and hamstrings. Definitely strengthening your quadriceps with any kind of squats. Single leg variations are nice to see what kind of load tolerance or quality of movement one leg has versus the other. Then definitely working on motor control. So you don't want to just have somebody just going through exercises without, being mindful of how you're doing them. Similarly, you want to be mindful of how they're pedaling your bike. Okay, so I kind of went through that fast. Does anybody have questions about knee issues? They make sense. All right, on to neck pain. Also super common. So if you think back to, again, the position of the guy sitting in his office chair with too much hyperextension of the neck, we have to do that on the bike because you're bent over and we're looking up to see the road, but you can control it to some degree, right? Remember when you're, when the neck is extended, when you're looking up, the facet joints, the joints in your neck are a bit more compressed. And a long sustained posture of this nature can cause increased stress, not only in the neck, it can cause headaches. I see a lot of patients for TMJ disorders, jaw pain. All of that's often from a forward head, lifted chin. So as you're riding your bike, again, you have to be a little bit extended in your neck, but the more you lengthen out your spine, drop the chin just a little bit and go back to that third thing, which is just changing your position, not being kind of hunkered down with your neck extended, but sitting up every once in a while. Pulling your shoulders back, moving around a little bit more can help reduce the stress on your neck. This isn't on the bike, but it's similar. So that forward head position. So you know your head can weigh anywhere from 8 to 12 pounds. Let's just call it 10. The more you hang your head forward, the heavier the weight is of your head. So that last image where your head is forward 60 degrees, instead of your head weighing 10 pounds, it's now 60 pounds relatively. So just the muscles are going to be overworked. You're going to get tired in your neck. You're going to have all these secondary muscles kicking in. So when the postural muscles get fatigued, the bigger muscles take over. And that's usually the muscles that are painful, overworked, hard to get relaxed. Back to the bike position. We've got an upright kind of recreational cyclist versus a road cyclist. Again, it's the reach of the bars. So as you're getting into a more aerodynamic position, you want to be sure that the reach of the bars is within normal angles or range. So you can raise the handlebars a little bit. I had a client once who was all she wanted to do was ride her kids to school, but she couldn't do it because her neck was really, really problematic. So a simple raising of the bars completely took care of the problem. And it didn't matter to her that she was aerodynamic. She just really wanted to be able to ride with her kids. Equipment-wise, the placement of your helmet and even sunglasses can play a role in stresses on the neck. So maybe you have really narrow sunglasses and you're looking up to see the road through the bottom of your sunglasses. That lifting of the chin can cause a lot of compression in the back of your neck. So it could be something as simple as get those really big wide sunglasses. So common imbalances in the neck. So on the bike, off the bike, maybe you're riding the bike, but now you've developed this forward head posture, whether it be from the bike itself or from just your seated posture. It's become habit. It creates this forward head posture. And we talk about this cross syndrome in a lot of the PT literature, where the muscles in the top of your neck, so if you just grab like your shoulders, upper trapezius area, that can get really, really tight. You know, some people just constantly have tension there. They're really tight there. Sternocleidomastoid is a muscle that runs right behind the jaw. Very, very commonly super tight in a lot of neck patients. Seeing every single one of my jaw patients has tightness there. And certainly some weakness in the deep neck flexors of the neck. So that goes back to that philosophy of if you have fatigue and over fatigue and smaller muscles that stabilize and or inhibition because of pain. So your neck hurts, you strained it, any kind of incident can cause an inhibition of the smaller stabilizing muscles. So the stabilizing muscles can get inhibited. Then that inhibition causes weakness, and that weakness continues to progress and cause more stress on other areas of your neck. So we see this all over throughout the body. In Ola Grimsby, they call it the manual therapy lesion, where stress, strain, pain causes an inhibition of the stabilizing muscles. So in the shoulder, it's really common. We see weakness in the rotator cuff, and there's a shoulder injury. In the lumbar spine and lower back, it's the deep stabilizing muscles in your abdominal and lower back. And in the neck, it's the deep neck flexors often that need to be retrained. So there's our excessive kyphosis or increased curvature in the upper back or the thoracic spine. Super important to stretch, mobilize, get your upper back moving. Increased kyphosis or increased rounding in the upper back contributes to stress in the neck, stress in the lower back. It also affects your breathing. So think of performance-wise, being able to take a deep breath. If you're really rounded in your upper back, that can be a factor. So things to remember are elongating your spine on the bike, taking those deep breaths like you did with Ted earlier can help increase the mobility of your rib cage, your diaphragm, help you to take deeper breaths, which will also improve your performance. So lots and lots of ways to improve thoracic mobility. Foam rolling can be one of them. On the right, that was a yoga specific yoga for cyclists workshop that I did. That's actually Ted in the red t-shirt there. So the muscles in the back of the neck get really shortened. Your suboccipital muscles are shown on the right there. So think about if you're lifting your chin, all the little muscles in the back of your head that attach to the upper part of your neck get really shortened, really painful. They can cause headaches, neck pain, all that good, not so good stuff. Areas to strengthen. So we're talking about the lower trapezius, rhomboids, the bigger muscles that help pull the shoulder blades down your back. I just wanted to show you a quick picture of the sternocleidomastoid. Again, big muscle that runs right behind the ear, and how the picture on the right are the trigger points of that muscle. So where you can get referral patterns. You can get headaches, jaw pain, pain all around the area of the muscle. Scalenes can often get overused in the neck, and that can cause pain in the chest, down the arm. The scalene muscles, anterior, middle, and posterior, attach to your first rib and can cause all kinds of other issues like numbness down the arm. Also, if you're breathing, as Ted kind of touched on earlier, from your chest, your scalene muscles are accessory muscles that you don't really want to overuse when you're breathing. So practicing the diaphragm breathing is another way to reduce the use of your scalenes and decrease the stress on those specific muscles. And then kind of wrapping it up with the neck is the deep neck flexors, longus capitis, longus coeli. When patients find these muscles, and it takes a while, it feels like the muscles are really just right in the front of your throat. They're like, is that really what's supposed to be working? But That's where they feel it. It's active. Those muscles are active when you cough, when you walk, when you swallow. It increases with head loading. So maybe in cultures where they're carrying things on their head, their necks are probably more stable and strong because they're working. So the longus colli and the little muscles in the back of the neck, your multifidus, provide proprioception and synergy. So where's your head in space? So back to the motor control, it takes 5,000 reps, six-ish weeks to retrain deep neck flexors, reduce the stress on the sternocleidomastoid, anterior scalene. So you're also training the head and neck position in all these different positions. So first we'll start laying on the back, might do some side bending, definitely on the bike in different positions. So training your head and neck with other exercises. I've seen that so many times with planks and in yoga where they're dropping the head down so far, they're creating a forward head position. So you really want to focus on getting those bigger muscles that we briefly touched on earlier to stabilize and pull the head back up. So the plank on the bottom screen is a really nicely aligned neck, lower back, everything else. You might have to, you've got somebody that's coming in, they're doing squats, they're doing their strength training, but they're hyperextending their neck a little too much, is the one shown on the right. So other examples are just, what are you doing in the gym? What are you doing on the bike? How can you retrain them not to overlift the head and neck? We talked about deep neck flexors, rotator cuff, laying on your stomach, doing Y's, T's, I's, core control, stretching the pectoral area to avoid a forward shoulder, contributing to the neck position. All of those things, and then really going through the thoracic mobility as well to help reduce the stress on the neck. I know this has been a long day, so everybody sit up straight. Make sure your neck's in a good position. Do some chin tucks or nods, drop your chin down. Give yourself a little neck break. All right, lastly, we're going to touch on the low back pain. Low back pain is super common in cyclists. A study from 2010, Journal of Sports Medicine said professional road cyclists, at least 45% of them report having back problems at some point in their career. 58% have had back pain in the last year. It's being in that prolonged bent over position. Obviously, that's a concern and a contributing factor. So when you talk about the spinal kinematics or the muscle activity in cyclists, if you over-round your lower back, studies show increased rounding, increased lumbar flexion is associated with low back pain. It's also associated, this is what we see in other literature too, that we see a loss of a co-contraction of the deep muscles in your lower back, your multifidus, and transverse abdominis. So positions of the back, you can adjust somewhat the bike position, right? But you can also be aware of excessively rounding your back. If you saw the picture of Christine on her time trial bike, her back is beautifully aligned. It's like the one in the middle. You don't want to try to arch your back. Some of the, not the literature, but stuff on the online as I was looking up pictures, some of them are suggesting that you keep a little bit of arch in your back. That's totally not possible or recommended. So on this picture, you got Peter Sagan on the left, Jan Ulrich on the right. You can see just a difference of a nice lengthened spine versus Jan's a little over-rounded there. Could be bike positioning, could be tightness in his hamstring, who knows. But you definitely, the one on the right is a little more risky for increasing stress on his lower back. So ways to assess this, somebody comes in, super easy screening tool that we use. How do you bend? How do you look when you bend over to touch your toes? Normal lumbar hip flexion is the combination of the hip and the lower back. This is A. They're really limited in their hips and their hamstrings. You're going to see increased rounding in the back. Maybe they've had a back injury and they don't want to round their back. They've kind of learned that felt better. They hinge at their hips and don't round their back enough. So B and C are abnormal. A is normal, and we're looking to restore that. So we're back to the motor control issue. I often use these pressure biofeedback with my patients to help teach them, give them some feedback to where their back is in space, because with the inhibition of your stabilizing muscles comes a loss of proprioception. They don't know where their back is in space. So this can give them some visual feedback. So again, you have an inhibition, which contributes to weakness in your core stabilizers. Again, associated with back pain, associated with rounding your back too much. Again, back to the positioning, you're too low in your drops, you're rounding your back too much, that could be a problem. It can increase the load on the discs, the ligaments, all the elements in the back of the spine. And definitely a position, bite position, how long you hold it, and your ability to, your core strength. So for the lower back, you want to target upper back mobility. You definitely want to work on the hamstrings for the drop, so you're not rounding your back as much, and the gluteal area. So the hip flexors get really, really tight when you're in a bent over position. We use our hip flexors on the bike. They're tightened and shortened when we're sitting in a chair. So stretching into hip extension, like a simple lunge or off a table even, are ways that you can help improve flexibility of your hip flexors. Then motor control, we're working on the inhibited muscles. So transverse abdominis, top right, little tiny muscle, multifidus. There's numerous studies that talk about the benefits of retraining and strengthening your multifidus. In fact, they have MRI images where if somebody has an acute injury in their back, like a disc bulge, and they do an MRI of your spine, you can see on the MRI where the multifidus has been inhibited and filled in with fatty infiltrate. And by retraining that muscle, you can change that to its normalized muscle, functioning correctly and decreasing load on the spine. So once you get those muscles kicking in a little bit better, you've got the multifidus working better, they're aware of their transverse abdominis, they can get those things firing and stabilizing a little bit better with simple things like laying on the table. Then you can progress to movement patterns such as hinging in the hips, hip extension, hip flexion, pulling up on your pedal stroke, for example. There's many ways you can do that in the PT clinic. So here's some examples of the hip hinging, squatting, deadlifting, single RDLs. Those are all, and hip thrusts are all good ways to teach a hip hinge and a stable spine. That's just a lit review of all the different things as a summary of muscle imbalances and bike position that you can refer back to. So in conclusion, overuse injuries are super common in cyclists. Treatment and prevention includes rechecking on the bike, making sure it's not a fit problem. Biomechanical evaluation, meaning checking their available range of motion, check their flexibility, check their strength and motor control, and perhaps maybe making some adjustments based on the cyclist anatomy and the appropriate training regimen. So going over, what are you doing for training? Are you overloading tissues? Is the load capacity off? Okay, that's it. Questions? There's a lot, huh? Well, number one, stretch, strengthen, motor control. And certainly if you don't know what to do, come see us.